Hi, I'm Chief Rob Wiley. Congratulations on purchasing the Hartwell Medical CombiCarrier II. Your service's selection of the innovative CombiCarrier II provides you with an incredibly reliable, durable, and highly functional piece of equipment to quickly and comfortably move injured or ill patients with minimal manipulation. Whether your service has adopted C-spine clearance procedures and new spinal motion restriction protocols or not, all the new evidence points to using devices that minimize patient movement during transfer and maximize patient comfort throughout the transport. Benefits not afforded by your older, more traditional flat backboards. Your CombiCarrier II is the ideal solution to meeting these new patient transfer requirements, and best of all, it can be done with one device. The CombiCarrier II can function as a scoop stretcher, and it can also function as an extrication board when the situation calls for it. So minimal movement and maximal patient comfort. That's the name of the game in today's new era of optimal patient handling. Let's take a closer look on how you can achieve this with your CombiCarrier II. One of the key features of your CombiCarrier II is it can function as two distinct devices depending on the situation. On one call it can be a scoop stretcher, and on the next call it can be an extrication board. Both of these configurations only require basic EMT skills, but keep in mind to always follow your local medical protocols when using the CombiCarrier II. Let's get started by using the CombiCarrier II as a scoop stretcher device. A common situation encountered in the field would be moving your patient from the ground or bed with minimal manipulation of your patient. From there, you can move your patient to the ambulance cot that would be located in a more open area of the home or building. First, place the CombiCarrier II next to your patient so the top of head grooves are lined up with the patient's head. To separate the CombiCarrier II into two sections, you'll need to grasp each section and pull back on the latch lever tab and then separate the two sections. Repeat this same procedure for the other end. If required by your local protocols, have someone maintain support of the patient's head while placing the separated halves under the patient. You may need to use additional personnel to slightly lift the patient's shoulders and hips in order to properly place the CombiCarrier II section under the patient. Also, it's important to note that you do not need to log roll the patient in order to place the CombiCarrier II under the patient using this method. Just a slight lift of the shoulders and hips will do the trick in most situations. Make sure the first half is properly positioned underneath the patient and then slide the other half of the CombiCarrier II under the patient. Now secure the latch assemblies one at a time and confirm they are fully locked before placing the restraints on the patient. Your CombiCarrier II is packaged with 4 two-piece patient restraints. 2 of the straps will form an X across the patient's chest, and another strap will be used at the hips. The last strap will be positioned above the knees. The 2 chest straps will need to be secured behind and around the top of the patient's shoulders. Along each side of the CombiCarrier II, you'll notice pins located in the handhold areas which allow various strap configurations to be used. Strap location should be determined by the patient's injuries and your local medical protocols. Remember, all straps should be snug, but should not impair the patient's breathing. When it comes to securing the patient's head, always follow your local medical protocols. And if you're using the Fast Splint full body or Fast Splint halfback, you can easily and comfortably stabilize the patient's head, neck, and torso together as one unit. Another option is the CombiCarrier II head immobilizer, a durable head immobilizer designed specifically to work with the CombiCarrier II. In addition to being used as a scoop stretcher, your CombiCarrier II is a very effective extrication board. Its features clearly outperform standard backboards that you may have been accustomed to in the past. Now, let's take a look at how to use your CombiCarrier II as an extrication board. Before positioning the CombiCarrier II next to the patient, make sure the side latches are securely fastened together and check to verify that the side halves remain together. Anytime you use the CombiCarrier II, whether as a scoop stretcher or a full extrication board, you must always position the CombiCarrier II next to the patient so that the top of the head grooves are lined up with the top of the patient's head. If your patient extends beyond the length of the CombiCarrier II, you may need to check as to whether additional support is needed. You can now log roll or lift your patient onto the CombiCarrier II. It's important to always maintain support of the patient's head during this procedure. Now recheck both latch assemblies and make sure they are fully locked, and from there you can begin the process of applying the straps to your patient. The CombiCarrier II is an ideal extrication device for motor vehicle accidents. In a common patient removal situation through a vehicle doorway, the CombiCarrier II can be placed on the edge of the car seat and the patient can be rotated and slid out onto the CombiCarrier II. You should always be sure to position and secure the patient restraints around the patient prior to moving the patient away from the vehicle, unless there is an immediate, life-threatening, or hazardous situation present. In the event the extrication is not through one of the vehicle doors, such as removing a patient through the back of the vehicle, the CombiCarrier II easily performs well in these situations. Make sure the CombiCarrier II is positioned as low as possible behind the patient, then lean the patient back until the patient is resting against the CombiCarrier II. With rescuers grasping the patient from each side, slide the patient up and onto the CombiCarrier II, while at the same time rotating the CombiCarrier II to as level a position as possible. A patient lifting device can also be used to ease the process of sliding a patient up and onto the CombiCarrier II. Maximizing patient comfort and minimizing patient movement can be further enhanced by using a vacuum mattress. With your CombiCarrier II, you can transfer your patient from the ground onto a vacuum mattress with minimal movement. Unlike conventional backboards, there's no need to log roll the patient when using the CombiCarrier II, and each half can easily be removed once the patient is transferred to the vacuum mattress. The CombiCarrier II can then be used underneath the vacuum mattress to facilitate end-to-end lifting if necessary. The CombiCarrier II can be placed into most basket stretchers, except those with leg dividers. When using a basket stretcher, secure the patient on the CombiCarrier II first. Then place the CombiCarrier II into the basket stretcher and secure it with the appropriate restraints provided with the stretcher. The CombiCarrier II will easily fit into most standard-sized backboard compartments, and it's recommended that you keep the CombiCarrier II stored as one piece with both halves latched together. The CombiCarrier II is easy to maintain and clean. The plastic surface does not need any special maintenance. The latches are the only moving parts of the CombiCarrier II, and you want to inspect them daily to ensure their smooth operation. In daily use, nicks and scrapes are bound to occur as normal wear and tear, but if you see significant damage to the device, or the latches are not operating properly, then you should take the CombiCarrier II out of service until it can be repaired or replaced. Avoid using any type of wax on the metal latches, as medical tape does not stick well to wax surfaces. Follow your local medical protocols when cleaning and disinfecting your CombiCarrier II. A 1% bleach solution can be used, but be sure to thoroughly rinse off the device with cool or lukewarm water. As for the latch assembly, it can be flushed out with soap and water, or a commercial disinfectant. Towel or air dry your CombiCarrier II before placing it back in service. The latches should not require any lubrication after cleaning. In harsh environments, a small amount of a Teflon-based spray lubricant can be used. Do not use oil or grease on latch assemblies. Make sure to also review the application guidelines that came with your CombiCarrier II for product specifications and a sample training and maintenance log that may be helpful to your organization. Well, that's it. You just saw how you can easily improve your patient care with your CombiCarrier II. Remember, minimizing patient movement and maximizing patient comfort are paramount with today's new evidence on spinal motion restriction. These were just a few of the most common examples that you may encounter in the field, and it would be impossible to demonstrate every situation that the CombiCarrier II could be used for. In any case, always follow your local medical protocols. I'm Chief Rob Wiley. Thank you for watching.